Welcome to the Deep Dive. We're so glad you're here as we plunge into a topic that, well, it hits close to home for countless dog owners, Canine Separation Distress Syndrome. You might know it better, perhaps, as separation anxiety.
That's the common term, yeah.
You sent us a fantastic stack of sources for this, really deep clinical guides and expert overviews, straight from the veterinary world.
Really solid material.
So our mission today is to really unpack these, pull out the essential insights, and help you understand exactly what SDS is, why it happens, how to spot it, how the experts actually diagnose it, and crucially, what can be done to help.
Yeah.
We're aiming to cut right through the noise and get to the most important knowledge nuggets from these resources for you.
And this topic truly is vital, as these clinical guides highlight. It's incredibly common, but also very often misunderstood.
Right.
It causes significant stress for both the dogs and their families, and sadly, it's a major reason why some dogs end up losing their homes. So getting this clear, expert perspective is incredibly valuable.
Absolutely.
Yeah.
Our goal here is to give you that core understanding. Okay, let's jump right in and unpack this. So starting with the basics, what is Canine Separation Distress Syndrome? What do these expert sources tell us is the defining characteristic?
Well, what's really striking is how precisely these clinical sources define it. They describe SDS as a behavioral disorder.
Okay, sort of.
Yeah, and the key characteristic, it's these undesirable behaviors that happen specifically or, almost exclusively when a dog is separated from their main attachment figure, usually the owner. And crucially, these behaviors aren't seen as malicious or, naughty. They're interpreted as clear signs of distress, real panic or anxiety.
So it's not the dog being deliberately bad, it's more like a panic attack when you leave.
That's precisely the point these guides make. It's a genuine emotional response rooted in anxiety.
Yeah.
And the significance, as they underscore, is that it's one of the most frequently diagnosed behavioral issues in dogs. It can severely strain that human-animal bond and is, unfortunately, a leading cause for dogs being relinquished to shelters.
That's heartbreaking to hear, but really important context. It sounds like a huge problem. Do the sources give us a sense of just how widespread this is?
They do mention estimates, though they vary quite a bit. Some suggest maybe 10% to 20% of companion dogs.
Oh.
Others offer a broader range, perhaps 7% up to 28%, or maybe even more experiencing some degree of it.
That's a pretty common, though.
Exactly. The exact number isn't as important as the clear message. It's a very common challenge. Many owners will likely face it in some way.
Okay, so it's common. And it's fundamentally about anxiety when they're left alone.
Yeah.
Now, here's where it gets really interesting for me. Why does it happen? Is there one single thing that causes it? Like maybe they had one bad experience.
Yeah, that's the question everyone wants a simple answer to, isn't it? But these clinical resources, they make it really clear there's absolutely no single cause. They describe SDS as multifactorial. Think of it like a complex recipe, several ingredients mixing together. Genetics, their early life experiences, learned associations, environmental factors.
Okay.
It's rarely, if ever, just one thing.
Multifactorial.
Right.
Okay, that makes sense. So what are some of those key ingredients or predisposing factors that these guides point to?
The sources list several key areas. First, they do discuss potential genetics and breed predisposition.
Oh, interesting.
Yeah. While more research is probably needed, there's a suggestion some breeds might have a higher tendency. They mention breeds like German Shepherds, Labs, Border Collies, Cocker Spaniels, Vizslas.
Yeah.
It seems tied perhaps to their inherent temperament and maybe how they cope with stress or changes.
Okay. What else?
A really significant area is early life experiences. These resources highlight things like inadequate socialization, meaning a puppy maybe didn't get enough positive, gradual exposure to being alone. Early weaning, being separated from their mother too soon, that's mentioned too. A history of abandonment or being passed between multiple owners is definitely a factor. Shelter and rescue dogs, they're notably overrepresented in SDS cases.
That makes sense.
And sadly, a history of abuse or neglect can also contribute, obviously, to a dog's overall insecurity and ability to cope alone.
Yeah, absolutely.
Changes are also major potential triggers. Sudden shifts in a dog's life, changes in routine, moving to a new house, changes in the household.
Like losing a person or another pet.
Exactly. Or a new baby arriving. Even just the owner's schedule changing drastically, like going back to the office after months of working from home. Changes in who the primary caretaker is, that's listed too.
Lots of potential triggers there.
Definitely. There's also discussion around over-attachment or hyper-attachment. Some theories in these sources propose that, well, maybe an excessively strong bond might lead to the owner's absence feeling like a massive threat.
Like separation is terrifying for them.
Sort of. They do mention signs like a dog constantly seeking attention or shadowing you everywhere.
The Velcro dog thing.
Right. But importantly, they note that a dog can have SDS without necessarily showing those specific signs of hyperattachment when the owner is home. It's not a prerequisite.
Okay, good distinction.
Now, a crucial point that might surprise owners, and one these guys really emphasize strongly, is the role of underlying medical conditions.
Like physical health issues.
Exactly. Things like chronic pain, neurological issues, maybe cognitive dysfunction, CDS, in older dogs, seizure disorders, even sensory loss like going blind or deaf. These can either mimic anxiety signs or just worsen a dog's ability to cope when alone.
Right.
They also point out that medical issues causing excessive thirst or urination, polyuria polydipsia, could lead to house soiling that looks like SDS but actually has a physical root cause.
That's a really important one to rule out.
Absolutely critical. And finally, learned behavior can play a role. Sometimes owners, totally unintentionally, reinforce anxious greetings or departures with too much fuss.
Making a big deal out of leaving or coming home.
Precisely. Or, even worse, punishing anxious behaviors like barking or destruction, which can actually increase the dog's overall anxiety and make the whole problem worse.
Wow. That connection to underlying medical issues and the idea that owners could unintentionally make it worse, those seem like really critical points that maybe aren't the first thing an owner thinks of.
They're definitely easy to overlook.
It's clearly so much more complex than just, my dog doesn't like being alone.
It really is.
Okay, so we know why it might happen, these multifactorial roots. Building on that, how do these sources say you can tell if a dog actually has separation distress syndrome? What does it look like?
This is where we get into the clinical signs. And the key diagnostic point that the guides emphasize again and again is that these behaviors must occur exclusively or predominantly when the dog is separated from their attachment figure.
Only when they're alone, basically.
Or mostly only then, yes. And often these signs start very soon after the owner leaves, sometimes within minutes.
Okay, so what are the common signs?
The common ones detailed are destructive behavior, often aimed right at exit points, doors, windows, maybe crates.
Like they're trying to escape.
Exactly. Trying to get out, trying to reunite, or chewing things that smell strongly of the owner, like shoes or clothes.
Right.
Self-mutilation is another one. Dogs might excessively lick or chew at themselves, paws, tails, flanks, sometimes causing sores, acrylic dermatitis.
Oof, yeah.
House soiling. Urinating or defecating indoors, even if the dog is normally perfectly house-trained, and it's not linked to other obvious triggers.
Even if you just took them out.
Yes, even then. Vocalization is a big one. Excessive, persistent barking, howling, whining, crying while alone.
Your poor neighbors.
Exactly. Pacing and restlessness just can't seem to settle down. Repetitive movements, wandering, hypersalivation, so excessive drooling, sometimes it can be quite extreme.
Wow.
Anorexia or inappetence, meaning they refuse to eat treats, play with toys, chew on things they normally love, but only when they're alone.
Huh. That's specific.
It is. Exaggerated greetings and departures, so really intense, frantic, maybe prolonged greetings when the owner comes back. And showing clear anxiety before the owner even leaves, shadowing, trembling, hiding, getting agitated when you pick up keys or put on a coat.
Those become cues, triggers.
Precisely. Those departure cues become major triggers, and in some cases, it can manifest more subtly, maybe as depression or lethargy when separated.
So if you're seeing things like chewing or accidents, but the critical factor is that it only happens when you're gone, and maybe starts almost right after you leave. That timing, that context, that's the biggest clue, right?
Absolutely. The context and timing are paramount. And that brings us to a really important point that these guides drive home. Rule-outs.
Meaning, what else could it be?
Exactly. It is absolutely essential to differentiate true SDS from other conditions that might look similar because they happen when the dog is alone. Because if you misdiagnose...
the treatment won't work.
Precisely. You'll be treating the wrong thing. So the sources list several conditions to consider. For house soiling, could it be just incomplete house training? Or a medical issue like a UTI, diabetes, kidney problems, maybe submissive urination, which happens during greetings usually, or territorial marking.
Which is often on vertical surfaces, right?
Often, yes. For destructive behavior, could it be normal puppy chewing? Or just boredom, where the destruction might be less focused, attention-seeking behavior maybe. Or fear, like a noise phobia triggered by thunder, or fear of strangers.
It's triggered by something specific, not just being alone.
Exactly. Or barrier frustration distress only when they're confined, like in a crate or behind a gate. For vocalization, maybe it's territorial, barking at things outside. Attention-seeking, responding to sounds, boredom again.
Okay.
Excitement urination tends to happen during greetings, not during the actual separation period. And in older dogs, you have to consider cognitive dysfunction syndrome, CDS. It can cause similar signs like anxiety or house soiling, but usually the behavioral changes are broader than just separation issues.
Wow, okay. That list of rule-outs really highlights how nuanced this is. It's not enough just to see a behavior. You have to understand the why, the when, the triggers.
You really do.
So how do the experts navigate this complexity? How do they actually diagnose SDS according to these clinical sources?
Well, the diagnosis relies very heavily on gathering a detailed behavioral history and careful observation. And it's critical that this happens after ruling out any underlying medical issues. That comes first.
Right. Check the physical health first.
Always. Then, the key diagnostic tools and steps highlighted are gathering a detailed behavioral history from the owner. These guides call this the most crucial criterion.
What kind of details?
Everything. Do the behaviors happen only when the dog is alone? What exactly are they? How severe? When do they start after departure? What's the owner's routine like? What's the dog's background rescue, early life? Any specific pre-departure triggers? What has the owner already tried? All of that.
Okay, a thorough history.
Extremely thorough. Then, owner-recorded video evidence. Highly recommended, often essential.
Because you see what actually happens.
Exactly. The sources say this provides objective proof of the behaviors, their intensity, how long they last, exactly when they start relative to departure. It's invaluable for confirming SDS and also ruling out those look-alike conditions.
You see that?
A thorough physical exam at minimum database of tests, as we mentioned, a full vet checkup, blood work, CBC, chemistry panel, urinalysis, maybe a thyroid panel, systematically checking for those medical mimics.
We love the physical stuff.
Definitely. And then the process involved systematically ruling out other behavioral conditions, sometimes using specific questionnaires, especially for things like CDS in older dogs.
Makes sense.
And the sources also strongly recommend referral to a veterinary behaviorist for severe or particularly complex cases.
That makes so much sense.
Absolutely.
As an owner, you often just see the aftermath, right? Or maybe hear the barking from outside. Getting objective video seems like a total game changer for the diagnostic process.
It really is. It takes out a lot of the guesswork.
Okay, we've defined it, dug into the roots, talked about the signs, the things it's not, and how the diagnosis is made. Now for the big one, treatment and management. I have a feeling, based on everything so far, there isn't simple magic wand here.
You are absolutely right. The sources are very, very clear. There is no quick fix. Successful treatment requires a comprehensive, multifaceted, multimodal approach.
Multimodal, meaning multiple things at once.
Exactly. Multiple strategies working together. And perhaps most critically, it requires significant and consistent commitment from the owner. That's huge.
Okay, so what are the pillars of this multimodal approach?
They outline 3 core pillars: behavior modification, environmental management, and pharmacotherapy, which is medication.
Got it. Behavior, environment, meds. Let's start with behavior modification.
Okay. Behavior modification is described as the absolute cornerstone of treatment. This focuses on changing the dog's underlying emotional response to being alone. Key strategies include desensitization and counterconditioning, or DSEC. This involves gradually exposing the dog to those things that predict you leaving, picking up keys, putting on your coat.
The departure cues.
Right. But you do it without actually leaving. And at the same time, you associate those cues with really positive things, like super high-value treats or calm praise. You practice these fake departures frequently, making the cues meaningless or even positive.
Okay, rewire the association.
Exactly. Then there's graduated departures. This is critical and, frankly, requires a lot of patience. You start with extremely short absences, maybe just seconds that the dog can tolerate without any signs of distress.
Below their anxiety threshold.
Precisely. Monitoring with video or audio is crucial here. You gradually increase the duration, maybe over days or weeks, but you must stay below that point where the dog gets anxious. If they show distress, you went too long.
And you have to backtrack.
You have to backtrack to a duration they can handle comfortably and build up more slowly.
Okay. Patience is key there.
Absolutely. Also, independence training. Teaching the dog to be comfortable, settling, and being calm even when you are home, but not necessarily right next to them.
Like in a different room.
Yeah, or on their bed while you're on the couch. These resources suggest having the owner initiate interactions calmly, maybe having the dog earn attention by being settled first, reducing that constant shadowing, and creating a positive, safe haven area for the dog where good things happen.
Building their confidence, being slightly separate.
Exactly.
Yeah.
And calm departures and greetings. Making leaving and returning really low-key. No big emotional farewells or frantic hellos.
Just matter of fact.
Pretty much. Ignore the dog calmly for a few minutes before you leave. Quiet exit. When you return, ignore them for maybe 5-10 minutes until they have settled down and then greet them calmly. This prevents reinforcing the anxiety around your comings and goings.
Stop feeding into the hype.
Essentially, yes. And finally, maintaining a structured routine for feeding, exercise, training, rest, that predictability helps reduce overall stress.
Okay, that's a lot on the behavior front. What about the second pillar, environmental management?
Right. Environmental management and enrichment. This is about making the dog's environment as supportive and, well, maybe distracting as possible when they have to be alone.
Making the alone time less stressful.
Exactly. Creating a positive safe space or den is important. A comfortable area, maybe a crate, but only if the dog is genuinely comfortable and relaxed in it. It should never be used for punishment. Or maybe it's just a specific room. It needs to be associated only with good things.
A happy place.
A happy, secure place. Providing enrichment during absences is vital. Things like high-value, engaging puzzle toys, food dispensers like a Kong stuffed with something yummy and maybe frozen.
Keeps it busy.
Keeps them busy and focused on something positive, especially during those tricky first few minutes after you leave.
Yeah.
Appropriate chew items, too.
Makes sense.
Ensuring adequate physical exercise and mental stimulation before you leave is also key. A tired dog, a mentally stimulated dog, is much more likely to rest.
A tired dog is a good dog, as they say.
Often true. Living on background noise like a radio, TV, or white noise machine can help mask potentially anxiety-inducing external sounds like traffic or neighbors.
Drown out triggers.
Can help, yeah. Using calming products like pheromones, things like adaptable diffusers, sprays, or collars might contribute to a more relaxing environment for some dogs.
Worth a try, maybe.
Some resources also mention using calming music specifically designed for dogs. And for longer absences, using a dog walker or daycare can be a management tool. It gives them a break from being alone.
But it's not a cure itself.
No, it manages the situation but doesn't fix the underlying anxiety about being alone. And any new situation like that needs to be introduced gradually.
Right. Okay, so behavior mod and environment. What about the third pillar, pharmacotherapy? Medication.
Yeah, pharmacotherapy, medication. These sources indicate that medication is often necessary, especially for moderate to severe cases.
Why is that?
Because sometimes the dog's anxiety is just too high for behavior modification alone to even start being effective. Or it might be needed for the dog's own safety if they're injuring themselves in panic.
So meds make the training possible.
Exactly. Medication isn't a substitute for training. It works by lowering the anxiety levels enough so that the behavior modification can actually work. The dog can learn because they aren't overwhelmed by panic.
Got it. What kinds of meds are used?
They describe different types. There are chronic medications. These are given daily and take several weeks, sometimes 4-8 weeks, to build up in the system and show their full effect.
So not an instant fix.
Definitely not. These include SSRIs, selective serotonin reuptake inhibitors. Fluoxetine is one, which is FDA approved for canine SDS under the name Reconcile, or used off-label like Prozac. Sertraline, Zoloft, or paroxetine, Paxil, are other off-label options. They increase serotonin activity. Side effects can happen, especially initially, like maybe some lethargy or GI upset. TCAs or tricyclic antidepressants like Clomipramine, FDA approved as Clomicalm, or off-label amitriptyline are also used. They affect serotonin and norepinephrine. Like SSRIs, they take weeks for full effect, and these are not for as-needed use. They have to be given daily as part of the long-term plan.
Daily, long-term.
Yeah.
Okay. Are there faster-acting options?
Yes, there are acute or situational medications. These are faster acting and sometimes used for specific high anxiety moments, often as an add-on to the daily meds or maybe just before a planned departure.
Like for occasional stressful events?
Sometimes, or to help bridge the gap while the daily meds take effect. Benzodiazepines like alprazolam, Xanax, or diazepam, Valium are mentioned for acute panic. But, and this is a big caution in the sources, they shouldn't be used long-term.
Why not?
They can interfere with learning, potentially cause paradoxical excitement in some dogs, and there's a risk of dependence, so used carefully and usually short-term. Trazodone is another option listed, often used acutely or as an adjunct. It tends to have a faster onset than the SSRI STAs. Gabapentin is also mentioned as an anxiolytic and analgesic that can be used acutely or sometimes chronically.
Are there non-prescription options mentioned?
Yeah, other supplements are mentioned for potentially mild cases or as adjuncts. Things like L-theanine, products with hydrolyzed milk protein like Zykeene or L-tryptophan. The sources suggest the evidence base for these varies, though.
So, more research needed there, perhaps.
Seems that way. The sources strongly emphasize that any medication requires a veterinary prescription and close monitoring. Regular checkups are essential.
Can't just get these online.
Absolutely not. They're typically used for many months, a year, or even longer in some cases, and must be tapered off very gradually under vet supervision when the time comes. You don't just stop them suddenly.
Right.
They also list important contraindications and precautions. Potential serious drug interactions, like with certain fleetic preventatives or other CNS drugs, cautions for dogs with heart conditions or epilepsy. And again, they warn that inappropriate behavior modification can actually increase anxiety, and crating must be approached with extreme caution. A panicked dog can badly injure themselves trying to escape a crate.
So the crate isn't always the answer.
Definitely not if the dog panics inside it. It can make things much worse.
Okay, that covers the 3 pillars. Is there anything else?
Yes, one final, absolutely vital component: owner education and support.
What does that involve?
These guides stress setting realistic expectations. This is usually a long-term commitment. There's often no magical cure, but significant improvement and effective management is possible. Consistency from the owner is key.
Managing expectations.
Crucially. And they explicitly state over and over, avoid punishment for any SDS-related behaviors.
Why is that so important?
Because punishment only increases the dog's fear and anxiety. It damages the trust and the bond with your dog, and it absolutely does not address the underlying panic. It makes things worse.
So patience and empathy are needed.
Immensely. Remembering this is genuine distress, not the dog being spiteful or bad. And for severe or unresponsive cases, referral to a board-certified veterinary behaviorist is highly recommended. They have specialized expertise.
That really paints a clear picture of just how much goes into managing this. It's tackling the behavior, the environment, and often the underlying brain chemistry. It definitely sounds like it requires immense dedication from the owner.
It absolutely does.
But the potential to significantly improve a dog's life seems huge.
It really is. The payoff in terms of the dog's welfare can be enormous.
So, pulling all of this together, what did these sources tell us about the prognosis? What can someone realistically expect in terms of outcome for a dog with SDS?
Well, the prognosis is described as variable. It really depends on a few things: the initial severity of the SDS, any underlying contributing factors we talked about, and maybe most importantly, the owner's ability to consistently implement that comprehensive multimodal treatment plan over the long term.
Owner commitment again.
It's central. They suggest a good prognosis for management in cases where a comprehensive, consistent plan is followed. You can typically achieve significant reduction in the distress behaviors and a much improved quality of life for the dog.
That's encouraging.
It is.
Yeah.
A fair prognosis is noted for more severe or long-standing cases. Significant improvement is often still possible, but complete resolution might be challenging. A guarded prognosis is usually reserved for the really severe, intractable cases that don't respond well despite best efforts, or where owner compliance with the complex plan is, for whatever reason, difficult.
Okay.
And a key takeaway these resources highlight is that for many dogs, ongoing management strategies will likely be necessary throughout their lives to prevent relapse.
So it's not always a fix-it-and-forget-it situation.
Often not. It might involve long-term, maybe lower-dose medication, definitely maintaining a consistent routine, continued enrichment. Lifelong management is a common reality for many dogs with SDS history.
So it sounds like the focus is less on a total cure in some cases and more on managing the condition effectively to provide the dog with a significantly calmer, less stressful life.
Exactly. Significant improvement, better welfare, better quality of life. That's the realistic and very achievable goal, but it often requires that continued consistent support.
This deep dive has really broken down separation distress syndrome, hasn't it?
Yeah.
From its precise definition and those complex multifactorial roots
Yeah, the why behind it.
to recognizing the signs And just as importantly, differentiating them from other issues. The critical diagnostic process, especially the value of video evidence,
Absolutely key.
and then that comprehensive multimodal approach needed for treatment and management behavior, environment, often medication, and owner commitment. It's clear these expert sources provide such a valuable, actionable roadmap for anyone facing this challenge with their dog.
Absolutely. And while it definitely demands patience and consistency, applying these strategies, ideally, under the guidance of a veterinary professional or behaviorist, can make a truly profound positive impact on the lives of these affected dogs and their families.
Okay, so here's something to leave you with, thinking about everything we've discussed. Considering that managing separation distress often involves such a deep dive into a dog's emotional state, their anxieties, and can require ongoing support, sometimes including long-term medication.
Oh,
What does that tell us about the depth of their emotional landscape, and how might it reshape our understanding of their needs beyond just basic care and training?
that's a powerful question to ponder.
Thank you for joining us for this deep dive, and thank you, our listener, for providing the comprehensive sources that made this exploration possible.